Clinical approach to a patient with pica. When evaluating a patient with pica, the primary goal is to identify the underlying cause, detect any complications, and provide comprehensive management. Since pica is often a symptom of an underlying biological, psychological, or environmental problem, a systematic approach is essential. The first step is obtaining a detailed history. Ask exactly what substances are being consumed, such as soil, clay, chalk, paper, hair, paint, or ice. Determine the frequency, duration, and quantity of ingestion, and identify any triggers such as boredom, anxiety, stress, sensory seeking, or self-soothing behaviors. A developmental history is particularly important in children, along with a review of medical illnesses, psychiatric disorders, medications, dietary habits, family history, psychosocial stressors, and cultural practices to distinguish pathological pica from culturally accepted behaviors. While taking the history, always look for red flag symptoms. These include abdominal pain, persistent vomiting, constipation, blood in the stool, unexplained weight loss, and signs of lead toxicity. The presence of these symptoms should immediately raise concern for serious medical complications requiring urgent evaluation. The next step is a comprehensive clinical examination. Perform a general physical examination with special attention to signs of nutritional deficiencies such as pallor, glossitis, koilonychia, or poor growth. Examine the abdomen for distension, tenderness, or palpable masses that may indicate intestinal obstruction or bezoar formation. Assess for neurodevelopmental disorders such as autism spectrum disorder, intellectual disability, or ADHD, and perform a psychiatric evaluation to identify obsessive-compulsive disorder, psychosis, depression, anxiety, or other mental illnesses. It is also important to evaluate the child's level of supervision and the home environment. Laboratory investigations help identify underlying deficiencies and complications. Routine investigations should include a complete blood count to look for anemia, serum iron studies including ferritin, serum zinc, calcium, magnesium, and liver and renal function tests. Thyroid function tests may be considered when clinically indicated. Specific investigations include blood lead levels in patients with possible paint exposure, stool examination for ova, cysts, and parasites, and pregnancy testing in women of childbearing age when appropriate. Imaging studies should be performed whenever complications are suspected. Abdominal X-rays or ultrasound can detect intestinal obstruction, constipation, or bezoars, while CT scanning may be required in complicated cases. After completing the assessment, integrate all the available information to formulate the diagnosis. Determine whether the primary contributors are nutritional deficiencies, medical illnesses, psychiatric disorders, neurodevelopmental disorders, or environmental factors. Identify precipitating and perpetuating factors, associated comorbidities, and estimate the patient's risk for complications. A biopsychosocial formulation provides the most comprehensive understanding of the condition. Management should always address the underlying cause. Correct iron, zinc, or other nutritional deficiencies and treat any associated medical illnesses. Behavioral therapy remains the cornerstone of treatment and includes positive reinforcement, modeling, habit reversal training, and, in selected cases, mild aversive techniques. Environmental interventions are equally important. Remove access to non-food substances, improve supervision, and provide safe oral or sensory alternatives for individuals who seek oral stimulation. Psychiatric disorders such as obsessive-compulsive disorder, depression, psychosis, and anxiety should be treated appropriately, while individuals with autism spectrum disorder or intellectual disability often benefit from structured behavioral programs. Family education is essential so caregivers understand the disorder, recognize complications early, and actively participate in treatment. Finally, regular follow-up is necessary. Monitor whether pica behaviors are reducing, reassess nutritional status and laboratory parameters, screen for new complications, reinforce behavioral interventions, and modify the treatment plan according to the patient's progress. The key message is to think of pica whenever a child or adult repeatedly ingests non-food substances. Always search for nutritional deficiencies and underlying psychiatric or developmental disorders. Rule out life-threatening complications early, treat the underlying cause rather than just the behavior, ensure a safe environment with active family involvement, and maintain regular follow-up to prevent relapse and improve long-term outcomes.